Hi guys, this is Dr. Priyanka Mehta, gynecologist and women's health expert from Diva Women's Center, Chennai. This video I'm going to talk to you about cramps in early pregnancy. Pregnancy is an amazing time, but sometimes there could be some tummy pain or cramps and then you really are not comfortable and you don't know what to do. So I'm going to tell you maybe 6 or 7 reasons for discomfort in your tummy, and if that is not the cause, then you probably need to reach out to your healthcare professional and to your gynecologist immediately. So because there are a lot of hormones which are changing, a lot of hormonal changes happening, there's a flood of hormones. So these hormones also sometimes can cause all kind of changes which are happening in your body, and these hormones will make you become sometimes there is fullness of the breast, or you kind of feel some period like cramps will be happening and you must be wondering what is happening. So that could just be because of the hormones. Then in pregnancy there is one hormone which is called Relaxin, and this hormone causes, along with progesterone, it causes all the processes to kind of slow down. So sometimes you can even have gas, you can have constipation, and that itself will cause some kind of fullness in your tummy and you are not able to digest your food also. So it is also because of the hormones called relaxin. Then the uterus itself is expanding, the uterus is becoming bigger and bigger because the uterus with each week of pregnancy is growing bigger, the muscle is becoming softer and bigger because it has to accommodate your baby. So this uterus is, as it is expanding, it does because it is a muscle. Sometimes there are some kind of contractions or some kind of cramps like pain which you'll be having. So usually if you just take some rest, drink lot of water, most of the time that cramps and that pain goes away. Another important reason is the uterus which is having your baby is actually attached to the side of your abdomen by these ligaments. So it is like a hammock is attached. So these ligaments also become very soft, and as the uterus is expanding in size, they get stretched, and this can cause a very sharp kind of pain which goes from here sideways, and that could just be a round ligament pain. Of course, in early pregnancy when there is pain, you should not forget about some problems which could be like there is something called ectopic pregnancy. So in ectopic pregnancy, the baby, instead of getting implanted into the uterus, gets fertilized and stays in the fallopian tube. So this pregnancy happens in the tube, and this can cause severe pain if it is bleeding inside or there is a problem. So if the pain is not relieved by rest and you are continuously having pain, or you're also having along with that loose stools and nausea and vomiting and you don't feel well, please reach out to your doctor immediately. One more cause is something called the corpus luteal cyst. So the corpus luteum is basically nothing but the ovary from which side the egg is produced, that forms a small little swelling or a cyst, and this is what will also give the hormones to maintain the early pregnancy. So this also can cause a lot of pain sometimes when the cyst becomes either big or there is some bleeding happening inside. So understand also that urinary tract infections are common in pregnancy. If you're not drinking enough water, you will keep having this funny kind of pains and aches in your lower tummy. So if you are not feeling well, and there is another reason which is called implantation pain or implantation bleeding. So as this baby, or the embryo as we call it, is getting fixed onto the lining inside the uterus, again sometimes there could be some kind of period like cramp, or even sometimes you can have 1 or 2 drops of bleeding also, so don't worry. So if there is just some funny pain which is coming once in a while and it goes away after that, or it is relieved when you're drinking water or you take something light to eat, then you don't have to worry about it. But if your pain is persistent and it is continuous, and along with that you're feeling giddy, you're having loose motions, you're having vomiting, you're not able to eat anything at all, it is very important that you don't ignore this pain, but you reach out to your doctor immediately and you take care of yourself. So stay healthy, stay active, have a routine in pregnancy. Try to make sure that you also get good sleep, good rest, drink a lot of water, and stay healthy and stay safe. Thank you.